Thank you.
Good morning. Welcome, and thank you all for joining us. My name is Karen Ayala, and I serve as the Executive Director here at the DuPage County Health Department. Today, we are pleased to announce the recipients of this year's grants offered by the HOPE Taskforce to address the opioid crisis in DuPage County. Unfortunately, the opioid crisis and COVID-19 pandemic are presenting unprecedented public health challenges as opioid-related overdoses and deaths continue to rise across the country and right here in DuPage County. Now, we understand the anxiety, stress, and loss of social supports from COVID-19 pandemic have been especially difficult for people who struggle with substance use disorders. In many ways, this pandemic was a perfect storm for people who are already struggling and unfortunately has left many without the resources to access treatment, recovery, and support during this challenging time. As we move forward, the DuPage County Health Department and the HOPE Task Force are committed to bringing care to the communities we serve in innovative and practical ways that will meet the evolving needs of our residents. We will continue to support critical resources to treatment and recovery while focusing on innovative solutions to prevent and reduce opioid addiction and overdose deaths in our community. As part of this important work, back in April, the HOPE Task Force announced grant funding in the amount of $125,000. This funding will support key strategies in addressing the opioid crisis, including community-based overdose response, prevention, including harm reduction, and integrated mental health and substance use disorder treatment and recovery services and resources. I'd like to thank the County Board Chairman, County Board, and Board of Health for their ongoing leadership and financial support to the ongoing opioid crisis in DuPage County. Together, like we do in DuPage, we will continue to battle and combat this crisis, helping to save lives and strengthen our communities. And with that, I'd like you to join me in welcoming DuPage County Chairman Dan Cronin.
Thank you, Karen. Thank you very much, everybody, for joining us together today, coming together for this this wonderful event. Karen, thanks for that introduction. I want to start out by saying I just really am so proud of the team and the leadership that you have provided here at the Public Health Department. I look around the room. We're very blessed to have some outstanding leaders in public health through an incredibly difficult time, challenging time. I'm just so impressed. I think the community's impressed. We thank you for your service. I see Janice Gilders over here and a board member. I see our team is out here, and I just want to thank you for your marvelous leadership and service to the community. Also want to recognize a couple of other folks. I see County Board Member Paula Deacon Garcia, who's on the Board of Health and the County Board. We have a great team at the County Board. I always say, you know, we're only as good as our team, and that's the way county government works. And I think whether it's by design or by accident, I think it really it helps us navigate through some difficult times when we have a good teamwork approach. I see Gwen Henry is here. Gwen, welcome. I'm glad you're here and part of it, and you provided outstanding leadership over the years. Sheriff Mendrick, the most outstanding sheriff in all of America, is here with us. Lyle Woodridge, Fire Protection District. Keith Creston, our chief from over there. Some old friends and some folks that are really devoted to this cause of heroin, opioid, prevention, education, the Stefani family, Roger and Marge Stefani and their son. They've had some experiences and they have a lot of wisdom to share with us and have done so over the years. The Heroin Opioid Prevention and Education Task Force is an interagency, interdisciplinary advisory group appointed by the county board with two co-chairmen or chairpersons, including County Board Member Greg Hart. Greg has been a passionate advocate in the fight against opioids since he joined the county board, and he's been a tremendous leader on this task force. And I want to thank Greg for your service. Greg has a deep desire to help our residents, as do all members of the board and the task force. I think working to develop HOPE Task Force as a model to fight heroin and opioid abuse has been really kind of a hallmark of what we've done here in the county, and we continue to do. Dr. Lanny Wilson is the other side of that equation and has been a marvelous leader and devoted public health official, doctor, leader, and has provided his experience and wisdom to the health board for many years and has been a tremendous asset. I want to thank you for bringing your ideas, your energy, your kindness, your tone, your demeanor. You just have a lot of really good characteristics, and we're glad to have you. There are several other countywide elected officials who have been invaluable. And of course, I always have to say, and I want to point out that Dr. Rich Jorgensen, who's sitting right here on my right, he's the one I think that sounded the alarm first, that talked about this crisis right in our backyard, and I want to thank him for his leadership. Of course, the state's attorney, our superintendent of schools, Darlene Rossetti, and all the folks on the front lines that have really served us well. We have a great team in DuPage, and I just want to give everybody a round of applause, if I may, real quick. Just real quick, I don't want to belabor too much of the program or take up too much of the time here. As we all know, the COVID pandemic has consumed our lives and our attention for the last 18 months, right? But our fight against the heroin and opioid epidemic has really never wavered. The members of the HOPE Task Force have not lost sight of this important battle. The group is diligent, dedicated, and will not stop fighting to protect and help our families and our residents, our citizens. The HOPE Task Force is, in my opinion, the gold standard for the fight against the opioid epidemic. I'm incredibly proud of what the task force has become in a short period of time, and it continues to grow and respond to the community. We know the number of opioid deaths is alarming, and it has been alarming, and it continues to be alarming, and it's of great concern. Thanks to the work of the task force over the last 4 years, they've helped a great number of people who are addicted to opioids get the treatment that they need. Thank you to the health department once again for their efforts to lead on the task force. It's certainly been a difficult year. I know the stress and strain that you have been under, and it's been a mighty stress, but you have performed valiantly every step of the way, and the task force has been part of the hallmark of your service here at the health department. During my time as chairman, we've demonstrated this fight is a high priority. This is the 4th year the county board has provided funding, total investment of $400,000. $100,000 a year. It doesn't sound like a lot of money, but if you make it a priority in terms of policy and you have the resources that we have assembled and built the foundation upon which and devote it to solving this problem, it is a tremendous amount of assets that have been dedicated to this. These grant recipients represent the future of our fight against heroin and opioids. But before we get there, it's important to recognize how we got to this point, and the HOPE Task Force certainly wouldn't be what it is today without the diligent work of our DuPage County Coroner, Dr. Rich Jorgensen. Again, the first one to sound the alarm. He's my leader. I follow his direction. Dr. Rich Jorgensen, please.
Thank you. I'm going to give a little context and current data of where we are. But as Dan pointed out, in 2013, we started to identify a crisis here in DuPage County. And to give you some context, that summer, in July, we had 18 people die in 1 month. And we started talking about this. We started having meetings. And out of that came the county board and the health department's dedication to addressing this issue, and also the development of what's called the DuPage Narcan Project. The Police Chiefs Association said, we keep coming to scenes where people are dying and we can't do anything. So we were able to outfit them with Narcan, the antidote for opioid overdoses. And amazingly, this county completely had every police officer in DuPage County outfitted by the end of 2014. To give you some context about the deaths, is that year we had about 38 deaths due to opioids. Last year we had 112. So we are not turning the ship around. It is continuing to get worse. But the DuPage Narcan project was very, very successful. To date, we have saved 1,115 lives with this program. That's your police officers going out and reversing somebody that's had an overdose. And we have this year alone, we've saved 117 lives, and that 117 is the highest number that we've had in a 6-month period of time. Excuse me. But we are not turning this around, as I said. So the demographic of 2020 was that we had 112 people die and an additional 18 people die of non-opioid deaths, like cocaine overdoses, things like that. This year, we are about on the same track. We have 56 overdoses, and the demographics are about the same. Females represent 28%, but we've had a change in the ages of the deaths. Previously, we had a number of teens and mainly 20-year-olds, and then it diminished after that. Now we have the majority of the deaths in 30-year-olds and the second most in 20-year-olds, and we've had no teens die in the last 2 years of overdoses, which is a very good signs. But there's a couple of changes I would like to talk about. Number one is that there are more suicides, and I always kind of think of overdoses and suicides kind of together. We have about 100 some per year for many years in the county. But this year we've had more suicides by overdose than we have ever had. And we've had 10 out of those 56 were actual suicides. And the second thing I want to point about is the pharmacy that's changed. When I first came here as coroner, it was all heroin overdoses. All the way to 2015, we only had heroin as our overdoses. In 2015, the drug dealers decided that fentanyl was an easier drug to sell and get available, and we started to see a transition into fentanyl. In 2016 and 2017, we had almost a complete transition to fentanyl and heroin. Starting in 2017, 2018, we started seeing polypharmacy. And so that's the thing that I want to talk about now, is what I call polypharmacy. So we will typically have somebody who has an overdose with 15 different drugs in their system, 2 or 3 different fentanyls, some heroin, some cocaine, some amphetamines, a couple of prescription drugs that are thrown in there. So we will see no one with just heroin anymore. So heroin is going away. We see multiple fentanyls and multiple other drugs, and that is becoming the drug of choice out there. So it's always been our attempt to try to reverse this. We got to keep doing this. I want to say thank you to Chairman Cronin and the county board and the Board of Health. As Chairman Cronin just said, it's the philosophy and it's the acceptance of this being a problem that's critically important. And there are places, I can tell you, that I've either spoken or been at, where they just say, well, we don't have a problem. So the ability of our leadership to say we have a problem, fund it, but also have that philosophy of wanting to change this has been critical in this county. I want to thank them for the $125,000 of money that has been funded, and all of the other things like the Narcan program and those type of things. So I'm happy to answer any questions later, but at this point, I would like to introduce County Board Member Greg Hart, who has been a tremendous advocate and leader in helping us fight this scourge. Thank you very much.
Hello, everyone. Thank you so much for being here. And thank you, Dr. Jorgensen, for your leadership and your kind words and for your insight. I think we can all agree that those statistics are certainly eye-opening and really underscores the importance of the types of programs that we're highlighting today. I want to thank you to Chairman Cronin as well, and for his guidance and support of this initiative, this task force throughout the duration of this opioid crisis. It's a constantly evolving issue. And Chairman, I think you've responded well in terms of your leadership over the county board on this. The county board and the chairman have been strong supporters on this issue and the Hope Task Force, and I want to thank them for their annual financial support. I'd also like to take a moment to recognize the other Hope Task Force members in the room today. We have a few of them, and as we like to say, we are a team addressing this issue. So Sheriff Mendrick is here, Chief Creston, Brad Gerke, others have been mentioned today. I want to thank Paula Deacon Garcia as well. And last but not least, my co-chair, Lanny Wilson and Karen Ayala for all of their leadership. I'd also be remiss if I didn't thank my county board colleague, Sam Tornatore, who also serves as president of the Board of Health. Sam unfortunately could not join us today, but he's been steadfast in his support of the task force, its efforts, and he's a tremendous resource to rely on. I can't thank Sam enough for his leadership and determination to safely guide the health department during these difficult times. Now, the coroner mentioned some very disturbing numbers, as I said before, but it's important to note the trends that we're experiencing are not unique to DuPage County. National overdose deaths have actually hit an all-time high in 2020, more than 93,000 people, which is a terrible and unsettling statistic. Again, this year was also full of records that nobody is proud of across the country. The most overdose deaths in general, the most opioid overdose deaths, the most stimulant overdose deaths, and the most fentanyl overdose deaths. It's been called an historic and unprecedented year, and combating the opioid epidemic is as critical as ever. It's important to remember that COVID was obviously a devastating year for all of us, and especially for those families impacted directly. But the effects of COVID went beyond the virus, and we're looking at that right now in our opioid statistics. That's why it's incredibly important that the task force remains focused on assessing opioid use within DuPage County and recommending effective and actionable policies, initiatives, and programs. In our fourth year of funding, the Hope Task Force focused on new and innovative proposals from local governments, charitable organizations, substance use disorder treatment providers, and other government entities to increase overdose response and prevention, including harm reduction, and provide integrated mental health and substance use disorder treatment and recovery. I want to thank all the groups and organizations who applied for these grants. It was obviously a rigorous process, and the decision-making process is always difficult. Previous grants have funded innovative projects that support treatment and recovery across DuPage County. Perhaps the longest serving standing program toward curbing opioid abuse in DuPage County is our Xbox program, which is something I'm sure most of us are aware. And that allows residents to drop prescription medication in secure drop boxes across the county. We've collected more than 66 tons of medication since this program launched in 2009. And that's an incredible number of drugs that have been kept off the streets and out of the hands of people who might abuse them. One of the first projects the Hope Task Force ever funded was the First Offender Court Unified for Success or Focus Court program. This court provides nonviolent first-time offenders the treatment, counseling, and education needed to successfully complete their probation. Focus has been recognized nationally by the National Association of Counties and has had tremendous success. Our residents who have gone through this court have an 87% success rate of completing all conditions of their probation, including drug testing, public service, and court appearances. In the past 4 years, we funded several other projects that have made a tremendous impact in our community, including peer support recovery groups, medication-assisted treatment, and more. Now, in summary, this is a crucial moment for our fight. It's a time where our resolve has certainly been tested. But despite everything, despite what we lived through the last year, and despite the statistics, there is reason for hope. We have 4 remarkable organizations that are here with us today that will provide exceptional support to the people needing it most and help them face their addiction and the support that they need and get the assistance that they need. I'm confident, as well as I'm sure most of you are confident, that a brighter tomorrow begins today. And with that, I'd like to invite my co-chairman, Lanny Wilson, to the podium to say some remarks, and then we'll get to announcing the grant recipients. Lanny?
Thank you, Mr. Member Greg Hart and co-chair. I've really enjoyed sharing the stage with you the last couple of years, and your leadership and demeanor are just so special. It's nice to be in your company, partner. At our meeting that we held just about an hour ago at the Hope Task Force, I mentioned how I was witnessing this culture of collaboration happening. And I first heard that term from a guy named Dick Indris, who was one of the founders of Access to Page. And when Access to Page joined forces with the health department and the hospitals around the county, he used the term culture of collaboration. And in that room and in this room, that's what's happening. This culture of collaboration that we know so well in DuPage County is at work. On behalf of the Hope Task Force, I'd like to add my thanks to Chairman Cronin. To borrow from the play Hamilton, I always enjoy being in the room where he makes things happen. He and the DuPage County Board have been leaders in addressing the opioid crisis here in DuPage County, and I thank them for that. I'd like to also thank the DuPage County Health Department under the leadership of our Director, Karen Ayala, and the Board of Health for their continued support of the task force's work. Our Board of Health President, Sam Tornatore, as Greg mentioned, is a friend and a fearless champion for public health. The opioid epidemic continues to be a serious public health issue here in DuPage County, as the story has been told over and over again during this last half hour. Further fueled by the COVID-19 pandemic and the isolation that it caused. We were well on our way to getting those numbers in the right direction, but the last year and a half, we haven't been able to meet at the Hope Task Force, and also the people suffering the problem of addiction have not been able to meet. They've been in isolation, so it's no wonder that we've seen a 17% increase. In fact, it's a wonder that the numbers aren't higher than they are. Given that 17% increase of overdose deaths in DuPage County, as documented by Dr. Jorgensen, one of our heroes, resources and collaborative programs are critically needed now more than ever. This issue further reminds us of the importance of the Hope Task Force's work as we look for additional opportunities to collaborate with our community partners in order to give support throughout our community. The $125,000 that was so generously given by the DuPage County Board is being awarded today and will support projects that align with Hope's framework, which includes 5 actions. 1, to reduce access to drugs. 2, to reduce opioid use and misuse. 3, increase overdose response. 4, provide integrated mental health and substance use disorder treatment and recovery. And 5, address substance use prevention and education. Thank you to all who submitted grant applications. This was a difficult decision process. I hate to say no to anybody, but sometimes you have to. There's only so many dollars out there, right? For those who were not selected, we encourage you to continue engaging with the task force and reapply in the future. You have great ideas. Finally, before announcing the great grant recipients, I would like to share and promote 2 important resources. If you know someone that is struggling with substance use disorder, we want to make sure you know about the resources that are available, including the Illinois Helpline for Opioids and Other Substances. Call 1-833-2-FIND-HELP. That's 1-833-2-FIND-HELP, or call 1-833-234-6343, or text HELP to 833-234. The helpline is available 24 hours a day, 7 days a week, 365 days a year, and is completely free. Also, please visit our Hope website at www.hopedupage.org to find more information and resources. Recovery is possible and is built on access to treatment and recovery support services. One program at a time, we hope to address the opioid crisis by providing sustainable, impactful resources for those struggling with substance use disorder in DuPage County. With that, I'd now like to invite my Hope Task Force co-chair, Mr. Greg Hart, to return to the microphone in order to present the 4 Hope Task grant recipients for 2021.
Well, this is indeed an exciting time, and one of the things that we pride ourselves on is the selectees that receive the grant dollars not only are they reviewed in terms of their potential impact on the community, but also the innovative nature of their programs, because this issue is constantly evolving and we need to make sure that we're putting our best foot forward with new ideas. So the first grant recipient that is proposing a brand new idea that I'm very pleased to announce is Hope for Healing with a $32,000 grant. So we want to give them a round of applause. And Hope for Healing's program, and I'm sure they'd love to tell you a little bit more about this, but in summary, they're going to be providing support for a harm reduction mobile outreach unit to provide outreach and engagement to individuals in need of support. Our mission is saving lives, and that's theirs as well, and we're really excited to partner with you. So again, Hope for Healing, congratulations. Dr. Wilson, I'll let you take the next one.
This is all about teamwork. Teamwork here at the podium, teamwork throughout the county. The next recipient is Advocate Good Samaritan Hospital. Their grant in the amount of $25,000. The funding will allow further development of their community linkage specialist, and this support will be given to patients struggling with substance use disorders and opioid use disorders. They call their program PERSIST, Patient Engagement and Retention in Specialist-Initiated Assessment and Treatment. Good job. Congratulations.
The next grant award is to NAMI DuPage for $31,000. So let's give them a round of applause. And as part of their program, NAMI will be providing twice per month support group and offer peer counseling services to clients with dual diagnoses. So we're really excited to partner with them on this project and looking forward to it. Congratulations. And last but not least, you got it.
The Haymark Center is being awarded $37,000. Their project title is Together DuPage. Haymarket Center Chicago will have a project-dedicated recovery coach, certified alcohol and other drug counselor who will work with the DuPage County Correctional Facility to engage recently released and soon-to-be released inmates in recovery supports via the evidence-based recovery coaching model. I'm sure Sheriff Mendrick will be working with you closely. Thank you.
Lots of applause, but let's give one more round of applause for all of our grant recipients today. This is incredible. So, and now we'd like to open it up for any questions that exist from members of the media or any members of the public that are here. And I will say there's also going to be an opportunity to talk with our grant recipients individually if there's specific questions on their programs. But anything more broadly, I'd like to open up the floor. Going once? That's a good sign, right? Okay. Well, we're happy to take any questions offline here, but thank you everyone for being here. Thank you for your support, and thank you to our new partners. We're looking forward to working with you. So thanks again. Appreciate it.
Very nice, Danny. Very nice. Yes. Very nice. I'm not opposed. Smooth.
Yes.